Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is a friend of many decades, Dr. Alan Thorson. Dr. Thorson is a clinical professor of surgery at both the University of Nebraska and at Creighton University in Omaha, Nebraska. Dr. Thorson is also past president of the American Society of Colorectal Surgeons and of the other ACS, the American Cancer Society. He is our newly elected PAC chair. Welcome, Dr. Thorson.
Thank you, Steve. That's very nice, very kind words, and happy to be here.
Glad to have you here. Congratulations on your very well-deserved election. You've got a great connectivity to advocacy and healthcare policy and understand the process. So you're certainly a natural choice for this important position. And I'd like you to start out to explain to our viewers and listeners a little bit about the PAC. Why does it exist? What was it meant to do? And why is it necessary to be separate from the ACS?
All pretty good questions there. Kind of a long answer, I suspect. But the primary purpose of the PAC is to help advance surgery's agenda to our leaders in the government. We support candidates for the purpose of having the ability to work with them and allow them to understand what the needs of surgery are when it comes to government interaction. The PAC has a long history of being supportive of political candidates who show interest in the college's agenda for the advancement of surgery, both for surgeons and our patients. The PAC supports this two ways. We have hard dollars, which are the dollars that we get from members as voluntary contributions. We have soft dollars, which come from corporations or from private practices, not individuals. Those dollars are not used to support candidates, they're used for administrative and educational purposes. As we select candidates to support, first of all, we look if they're up for election, we look at the viability of their campaign. What's the chances that they actually will be elected? Because we want to use our dollars as efficiently as possible. We then also look at their professional qualifications. Obviously, if they're a surgeon, that's critically important. If they're an MD, that's important. And then as other health professionals are involved, could be an RN, could be a pharmacist, anybody who has some knowledge and ability to recognize the importance of our activities at the level of the Congress. We also look at candidates who are members of committees that may be important, healthcare committees, who may have some influence on healthcare policy. We looked at voting records to see if they've been supportive of our advocacy efforts in the past. We also look at leaders in their party, and that both parties. We're very political. We have to be political in the sense that we're working in a political environment, but we also are very nonpartisan. And historically, because of the criteria we utilize to build the agenda of the college, we have historically supported Republicans and Democrats approximately equally. Sometimes there's more Democrats, sometimes there's more Republicans, but it all depends upon those criteria and how we select who we support.
That's all very useful information. How is it weighed in terms of supporting somebody who is an incumbent versus a challenger, somebody who is an incumbent versus two people running for an open seat?
Well, again, I think that it wouldn't make any difference based on the criteria I talked about. In that situation, we would look again at particularly the viability of the campaign. Who do we think is likely to be successful so that we can support that candidate? And then all those other criteria we look at. If the incumbent has not been supportive of the college at all in the past, and the candidate seems to offer support, or if they're an MD, a surgeon, all those factors come into play in how we select the individuals that we are going to support.
Does the PAC get involved in primary races?
That's a good question. If you look at the amount of donations that are possible, for like an individual, if you wanted to donate to a candidate, you're limited to $2,700 a year. Okay. The PAC can donate up to $5,000 per year to a candidate, but they can donate that amount based on each election. And we do work in the different elections. If there's a primary election, we can donate $5,000 there. If they're successful, we could donate another $5,000 to the general election. And let's say that after the primary, there's a runoff election. Some states have situations where they get runoffs. We could donate another $5,000 there. So potentially, legally, the PAC could donate up to $15,000 to one individual's campaign.
Another question that I've heard posed is why does the PAC need to be separate than the ACS?
The ACS itself is a 501c3. 501c3 corporations, in the eyes of the IRS, are educational entities. And they're restricted from supporting candidates totally. They can do some advocacy work, but they're very limited in that too. The amount of that has never really been strictly defined. It's kind of at the discretion of the IRS. So as a C3, the ACS is really limited in how active they can be in working through the advocacy work for our agenda at the federal level. The PAC is a C6, and it was established 20 years ago. It became quite apparent that the government interactions were having a larger and larger impact on the practice of surgery, the practice of medicine. To help work through those issues that were becoming important, the college needed to have a voice at the table. And one way to do that, the best way to do that, would be to form an organization that would allow us to support candidates and to be involved in lobbying to explain how the issues that the government was working through were going to impact the surgical field. And when I say surgical field, I want to reemphasize we're talking about not just surgeons, but also our patients, because what the government does can have a huge impact on our surgical patients also. So it's C3 versus C6. The C6 allows us to be active in those areas that are so critically important to the things the government does that impact our practice and our patients.
You mentioned a moment ago the federal level. Does the PAC get involved in any state races, gubernatorial or state house?
So that's an excellent question also. So legally we could, but the purpose of this PAC, as defined by the regents and the ACS board, is to support candidates only at the federal level. The Health Policy and Advocacy Group can help support state level efforts through more of an educational process, administrative process perhaps, but as far as our candidate support, that's only at the federal level.
Okay, great. And in terms of supporting the PAC, of course, it's vital that every fellow who is eligible to support the PAC does support the PAC. Who of the fellows and our non-fellows eligible to support the PAC?
All members of the college are able to support the PAC. That means there's about 60,000 of us that are able to support the PAC. That gives us the potential to be a very, very strong PAC if we had everyone participate. And that's a great opportunity for me to emphasize that participation is critical. Sometimes people feel that, well, I can't give $5,000. I can't give $1,000. I can't give $500. You know, the participation is as critical in one sense as the money. So $25, $50, you know, whatever it is, if we can get participation of our members, it provides us more legitimacy in DC, enhances our legitimacy. So I encourage everybody, you know, don't worry about the amount. Obviously, for those that are comfortable giving larger amounts, that's terrific. But the numbers that we have participating, this is critical in a separate sense.
As we look at those 60,000, are there anybody amongst that cohort who would not be eligible? For example, overseas members and fellows, or if somebody is not a U.S. citizen but practicing and residing in the U.S., I just want people to understand who can and can't give.
Yeah, so foreign dollars are not accepted in political campaigns. Membership in the PAC is limited to members who live and work in the United States, and those who are overseas working are not eligible to participate in the PAC.
That's very helpful information. And then, you know, one other thing you mentioned about is not necessarily the amount, but are there other ways somebody could help out? I mean, for example, hosting a candidate running for election and a get-together, assuming get-togethers happen in 2022, to help talk to that person and educate them about surgical issues?
Sure. So there's a number of avenues. That's a good question too. So we start with Surgeon's Voice, which is a program of the college, and you can log into facs.org and go to the advocacy banner and get to Surgeon's Voice. And the Surgeon's Voice lists those advocacy issues that are currently important to the college. And you can click on those, and then you have the option to make a call or to write a letter, an email. You can click on that, and it will pull up your representatives, your 2 senators, and your House representative. And there's a form, there's a letter that written about that particular policy, that issue. It can be modified. You could wipe out the whole letter and make your own personal letter in there. You could add or subtract, but then you just push a button and it goes. If you want to make a call, it's awesome because you can hit the call button. It will respond by saying you'll get a call back in a few minutes, and usually it's a few seconds. You'll get a call, and it's all put together so that it will say that we're going to dial up Senator so-and-so or Representative so-and-so, and then you get connected to their office. If it's after hours, you'll get a voicemail. You can leave a message. The other thing the college does for you, it gives you a script. And you can just read the script if you want, or you can use that kind of as a background to help you make points that need to be made. It's extremely easy. It's terribly helpful to the college for people to participate in that. Then there's the lobby days. The ACS Leadership and Advocacy Summit this year is scheduled from April 1st through the 4th. That's an opportunity to join other fellows. We actually make Hill visits. We've done that virtually here the last year. Hopefully this year, perhaps we'll be in person. If not, you can still actually visit with your representative's office or the representative themselves. And oftentimes the office in DC makes all those arrangements, so it's very simple. And then there's also an option on Surgeon's Voice where you can arrange to visit with your representative or their office at home, in your home state. So you can make arrangements when the representative is going to be on break and back in the state, or you can just make a visit to the office with the staff that's there, which is also extremely helpful. But again, if you go through that process in the Surgeon's Voice, the office helps set that up for you. So it makes it very, very simple. And again, you have all the background information available to help with that visit.
Well, thank you for that wealth of information. And I can personally attest to the ease of accessing the information and writing to and calling my senators and House representative. I've done it many, many times. The script is helpful. The buttons to send the letter is helpful. The buttons for the calls, all of what you said is true and it's easy. And it's essential. I want to echo what you said. It is essential that every single eligible member and fellow participate to whatever degree they can, whether it's $25, $2,500 or $5,000, whatever the level is, every bit helps, as well as, very importantly, availing ourselves of our right as Americans to speak with the people we've elected and let them know the importance of the issues. Thank you, Dr. Thorson, for all the information. Thanks for everything you've done thus far and that you're going to do as chair of the PAC. And I look forward to hopefully seeing folks in person at the Leadership and Advocacy Summit.
Thank you, Steve. I really appreciated the opportunity to share this information and hopefully better acquaint our membership with PAC and its purpose.